overweight used to be socially unacceptable, but now it's ballooned into something dangerous.
Body mass index of the clinically obese spreading everywhere.
We're spending $150 billion a year.
Britain is essentially sleepwalking into a crisis.
In Mexico, 70% of all adults are overweight.
In the past 30 years, the number of obese kids in the U.S. has tripled.
And so readily available, and therefore so
Okay,
so if it charges one ingredient,
but this is a crisis hitting our wallets as well. America's spends overweight or obese.
Obese children.
Obesity.
Obesity.
Epidemic.
Obesity.
Obesity inevitable.
Obesity has been an increasing problem in the United States. On the obesity front, public health groups such as the American Heart Association and the National Cancer Institute have advocated efforts to improve dietary habits since 1952, when the AHA identified obesity as a major cardiac risk. However, the federal government did not officially acknowledge the connection between diet and the risk of chronic disease until 1969. Action has focused primarily on the collecting of information and the sponsoring of further results. Some private groups, like the ones mentioned above, go on obesity-ending crusades, such as Michelle Obama's Let's Move campaign.
My kids have to get up and move. They can't sit in front of the TV. I have my girls involved in sports because I want them as young women to understand what it feels like to compete and to win and to run and to sweat.
Even though these kinds of campaigns have good intentions, they are hardly enough. Obesity has taken a huge toll on our economy and well-being. As prices decrease, the demand for fast food increases. This means that the supply curve is shifting right because food industries are willing to provide larger quantities at the same price. So, it comes as no surprise that the highest percentage of obesity is found in the lower class, who don't have a lot of money to spend on food.
Like, I know I should stop. I know I shouldn't have ordered it, but it's good. It tastes good. It's not good for me, but I'm still gonna eat it.
Usually, if people are buying cheap food, they also can't afford insurance. So now there are obese people with health problems and no medical fallback. When they suffer from heart attacks and the like, it is our tax money that pay for their care. This causes insurance prices to rise.
Go.
Hi, I'm Dr. Miller. I'm a pediatrician, and I've noted a disturbing trend in the past decade and a half. Our youth are becoming obese. This means more chronic diseases such as high blood pressure, heart disease, and diabetes type 2. I've actually had to admit patients with diabetic comas, something that used to just be seen primarily in the adult world. These diseases are chronic and expensive. They drain our healthcare dollar. And if it persists, this trend will actually drain our economy. This must be addressed. This trend must end.
What should the government do about the obesity epidemic?
I believe the government should stop subsidizing crops like corn, so they use less corn, high fructose corn syrup, so people won't have as much sugar in their diet.
What does the economy do to help solve obesity?
Well, I would say that they could tax the fast food companies and raise their prices so it wouldn't be as easy to get. Like, it would be like the same price as going to the market and getting a healthy food kind of thing.
Ready? How can we use the economy to help solve obesity or help obesity?
Well, the government can help out the lower income families so that the lower income families can afford healthier food.
What do you think about obesity and what do you think that we can do to help it?
I think obesity is a very big problem, and in order to help this situation, I think schools should have more of a focus on fitness and eating healthy.
The lower classes turn towards fast food because of its incredibly cheap prices in comparison to healthy alternatives. In order to remedy this situation, we propose what is known as a fat tax. This entails taxing the sale and purchase of unhealthy foods, thus raising its price. However, if this alone were to be done, all food would be expensive, and the poor would simply not have the means to fill their stomachs. This took place in Denmark. The Danish government set up a fat tax in order to reduce bad eating habits in their country, but it only led to the importing of unhealthy food in order to avoid the tax that they had imposed. The loss of jobs and a constant rate of obesity. We propose that instead of subsidizing meat and dairy products like our government currently does, we use the revenue from the fat tax, as well as the currently allotted subsidy funds, to subsidize healthy foods like fruits and vegetables. This would lead to a situation where you could buy 5 salads for the price of 1 burger, and hopefully would decrease the rate of obesity in our country.
Like I'm getting nowhere. And when I look at the fat on my body, it just seems impossible. And the fluctuations in the scale, even though I'm working out, make it very hard to keep going, and I just want it gone. I want all the fat gone